We all need human services. We're talking about childcare. We're talking about child welfare, physical and mental health. We're talking about immigration. We're talking about homelessness. We're talking about the spectrum of people's basic needs from womb to tomb. Without human services, we wouldn't be able to claim to be human. We wouldn't be able to claim to be the caring society we tell people we are.
My name is Sarah Muller. I'm a community health nurse with the Little Sisters of the Assumption Family Health Service. Since moving to New Jersey, it takes me 2 hours to get to work in East Harlem. I drive to the bus, take the bus to the city, take a subway, and then another bus to get to the office. Commuting that long every day is exhausting, but I do it because I love my job. I work with LSA, and our focus is to work with the most vulnerable families. We provide services such as a food pantry and advocacy office, early childhood services, parenting classes and groups, and a home health agency, of which I work as a visiting nurse. On Monday mornings, a lot of the morning is just spent catching up and checking in with patients. ¿Cómo está todo? Bien. ¿Y el bebé? The biggest barrier right now is poverty. Just dire poverty.
There are a lot of poor neighborhoods throughout the country and throughout the city. East Harlem houses some of the poorest families in New York City. East Harlem residents have an unduly high rate of illness and mortality.
On average, I visit about 15 patients or so a week. I especially love visiting the children and families that I get to know and develop a relationship with. It's Sarah. Hey, Kayvon, how are you? Good. So tell me, since I've seen you last, you've started school. LSA uses a holistic approach when working with any of our families. So often when we come in with an agenda, something that we want to work with, the family is dealing with other issues that take more precedent, such as having food or housing. For example, when working with a family like Kayvon, who has asthma, I will go in to work on medications, but if he's breathing air that's unclean, my education will only go so far. So I'm working with our environmental program, who are going in, working with the triggers for asthma, which are cockroaches, the mold, the mice.
I'm telling you, I wish asthma on nobody. Yep, the person that don't have it, God bless them.
Both of them had been in the emergency room almost monthly, but until our services came in and deal with a holistic approach to the asthma, neither of them have been into the hospital. And so our home visits are much cheaper than an ER visit or hospitalization. Okay. Keep them out of the hospital. It's working so far, so yes. I'm really happy to hear that.
Yes, I really appreciate it.
Yeah.
And thank you so much.
Building trust is essential to making any progress for the family. Sometimes I feel like I'm able to gain a trust by the end of an hour visit. Other times it takes persistence and just the family knowing that I'm here for them. Well, baby Joseph and his parents, Kayla and Danny, were referred to us after Joseph was born with a cleft palate and micronathia, a very small jaw. He had surgery after being born to pull out his jaw, but we were asked to go in to support the family in the care for a child with multiple needs. And I won't need to come back anymore, but you have my number. Any questions you have, you know where to get a hold of me. I consider it a success. When I've been working with the family, we have gained that mutual trust, and I can close the case knowing that the family is self-sufficient, is confident, and able to meet the needs on their own. I really feel that the work that I'm doing affects the families now, but also for many years to come, especially those families who are most vulnerable and most likely to fall through the cracks. But the reality is that I won't be here forever. And with the recession and the impact and the unknown, it's unclear whether my position can be replaced. And so that does give great concern of what will happen with these most vulnerable families and who will be there to make sure that they do not fall through the cracks.
are human service organizations important? Picture a world without them. Picture no senior centers. Picture no Meals on Wheels. Picture no after-school programs. Picture no recreation programs. Picture no help for immigrants. Picture no HIV/AIDS clinics. Go one by one and picture none. And all those people, those 2.2 million we serve every day, they're still there with increased suffering and increased despair. But we're a caring society. That's why human service organizations are needed. This is the right thing to do.